In this video, we will go over the different microcatheters that are available for coronary and cardiac interventions. These can be utilized for peripheral interventions. However, there is a different set of microcatheters for peripheral interventions. So we'll be talking about first the indications. In terms of the indications, we will talk about we'll be talking about the different places that we can use these microcatheters. So the most common use has been the guide wire exchange. So there's some exchange catheters. Best to utilize these ones when the cheaper versions of the microcatheters. So there are many microcatheters which are much cheaper, like Mini is one of them. That you can just exchange the guide wire. So you're not really looking for penetration through a CTO or torqueability in this type of catheters. Microcatheters are also good for providing better control of the guide wire to cross through the tortuous vessels. The torqueability of the wire increases by almost 4 times when there's a wire inside of the microcatheter. You can do a reverse wire kind of access into a side branch, which is very challenging with this. So if this is a vessel, okay, and the vessel is difficult to wire, you can put a microcatheter on this and make a J-shaped structure with about, I would say, 5 millimeter wire here with a tip, and then you can push it forwards and then bring the microcatheter and the wire back where it hooks into the vessel, and then you can jiggle it in there. Microcatheter is also used for contrast-assisted plaque modification, where you can inject the dye at the proximal cap. So if this is the vessel, this is the proximal cap, you can put a microcatheter right up to the tip, or you can even inject it inside the plaque to make dissection planes in there or star in there. You can subintimal track in there, or if you inject right at the tip, you can soften the plaque and the wire may go through this. Microcatheters are also used to inject contrast to confirm the distal vessel. So you can be after crossing this and you don't have any flow after injection from the guide, you can get this distally and then inject there and see where the injection goes. Now there's a risk that you may be still subintimal, so it can cause a subintimal hematoma, but if in the lumen, you will be able to see the contrast trickling down in there. In addition, if you have a dual lumen catheter, you can still keep a wire and inject through the side port of the dual lumen to see if there's any contrast there. You can utilize this by pulling it backwards to see where the plaque distal edge is and the proximal edges, if that will help you in deciding the length of the stent, because frequently there is no flow distally. So it is a great way to do that. Microcatheters can also be used to do pedal wiring, which is one of the ways to deal with antegrade wire escalation, where you put a wire, and if the wire is not going forward, you put another wire on the side, and if it goes into a intimal or subintimal space. Microcatheters can also be used to inject drugs distally in cases of no reflow. So you can slowly inject the medications such as nipride, such as diltiazem, verapamil, adenosine, epinephrine. There's so many medicines that you can utilize for treating the no reflow. So recommended to do that closer to the distal vasculature. You can deliver coils for end vessel perforations through them, or you can close SVG graft using them. So frequently we use Turnpike, Corsair, Caravel. So you need the larger lumen microcatheters for delivery of the coils. I will talk a little bit about coils at the end. You can deliver fat or thrombin for distal end perforations, or you can just inject air in the very distal end perforations, and the air column will stay there and the blood will not leak out of those perforations. You can, as I mentioned, you can distally inject for evaluation of the plaque length with the dual lumen catheter. You can use some of the microcatheters can modify plaque, such as Corsair RMET or Tornus or Turnpike Gold. These are different versions where you can torque them and actually kind of drill through the plaque to penetrate through. Frequently, the microcatheter is not going through. My go-to next is that I use one of these plaque modifiers so to deeply seat my microcatheters in there. It can help in protecting side branches while performing atherectomy. So let's say you are performing atherectomy and there's a side branch disease. This is the LAD, circ, and you have a 8 French guide. You can put a microcatheter on the wire and then try to do the atherectomy here. Now this can get damaged. This is off-label use, but people have utilized it to avoid damage to the wire. It can be used for vessel protection in retrograde CTOs, and the utility over there is usually for the 120 cm, 150 cm device that we use. Usually for most microcatheter usage is 135 cm. But 150 would be when you're trying to get to the lima or at the end of the lima catheter, lima vessel in the bypass patients, or when you're doing CTOs, because let's say this is the left main, and then you have through collaterals, you have the right coronary artery. You want to protect it, because if it is unprotected, this vessel can get dissected from the effect of the wire as like a cheese grating effect, or what do you call this? It could slice through the end. So the wire should be completely protected with the microcatheter wherever it is in the left main or in the inside of the LAD. It helps in increasing the support. So some of the microcatheters are stiff, especially the large microcatheters. I'll go over the large microcatheters in the next slide. It can also help in capturing spider or embolic protection devices. So sometimes, the embolic protection devices come with some kind of microcatheter, which can help you pull back the device inside the microcatheter. However, sometimes it's not possible, or it happens with people that the microcatheter can drop. You can use some of the microcatheters to capture these embolic devices. And I talked about this already, that you can use it for parallel wiring. So quite a bit of uses. These are kind of, I've made these classifications or types. That's how I think about them. You should have at least one out of these first 4 or 5 versions. Okay, so large ones, some said tough and stiff. That's how I remember. Corsair, Turnpike, ProGrade, or Mamba. Mamba is pretty good pushable microcatheter. So I think out of all of them, this would be the best. The other ones are good too, like Corsair and Turnpike. ProGrade is mostly for delivering coils and devices, coils in a location. But can you deliver the coils through them? Yeah, you can deliver from all of them. These are Turnpike and Corsair more tortuous, and they're torqueable. You can turn them. Mamba is also really good in pushing. The small ones are the ones that we use mostly for the CTO procedures. So Caravel is one. Fine Cross has a very nice tip, which is like almost 1.6 millimeter in size. Turnpike LP, it is rotational. You can rotate it. Corsair Pro XS or Corsair XS, Micro 14, Teleport, and Mamba Flex. It has good pushability, and also it goes through tortuous vessels. The best out of this in which is softer and goes through very tortuous vessels are these two, Caravel and Fine Cross. Turnpike LP and Corsair Pro XS are really good because there's a little bit of stiffness and they have braids. So they also help a lot in tortuous vessels, but very, very tortuous vessels, they may have an issue. Caravel has excellent profile, crossing profile. Caravel has 1.9 French size at the distal tip, or the crossing profile. It's like almost 0.62 millimeter in size. So pretty good. So imagine a balloon of 1.0, if it's not crossing, you may be able to cross with this. Two Caravels can fit one 6 French guide. So that's the cool thing about this. You can put two in there. It can go through the collaterals as well. Soft tip, it is a soft tip. The issue with that is you don't want to rotate it, because sometimes the tip can get stuck, and I have had seen cases where the tip got stuck and the tip broke off the Caravel. Fine Cross is nicer in the way it also goes through tortuous vessels. However, it also has a good push, which I like about this this type of catheter. It is a stainless steel braid construction. As I said, 1.6 is really 1.8. So the tip is like a little, so the crossing profile is a little larger because the outer diameter is about 2.6 French at places. So Caravel is much smaller than Fine Cross, but again, as it is larger, it is more pushable. In the case of Turnpike LP, we have there's a standard Turnpike that I mentioned before, but the low profile LP is a low profile. It's really good in going through retrograde collateral vessels, as well as doing the antegrade procedures. As I said, this is as a tapered end and has a braid behind it, which really helps in pushing this catheter. So my go-to use catheter is actually Turnpike LP these days. In terms of the other ones, Corsair Pro or Corsair Pro XS, which is a near catheter, it is again a rotational catheter, just like Turnpike LP. It has tip entry is around 1.3 French, so it's really good in doing CTOs with a crossing profile of 2.1 French. So again, a little larger than Caravel, but the crossing profile is great, really good for performing complex cases. You don't want to rotate it more than 10 times in the direction. There's also Corsair Pro that I don't use anymore. Again, the tip is 1.3 French in that as well, and it can be very helpful in if you want to have one of the Corsairs. I like to have Corsair XS Pro XS in the lab and Corsair separately, because the Corsair is much more pushability. In terms of other microcatheters, Microcross 14 is a good catheter as well, not widely available. but I would say that the other catheters are much better, so why use them? Teleport is by CSI. They came up with two devices as well, I think 2.1 French and 2.6 French or 2.4 French. Um, you know, I did not like it in terms of its crossability and its stiffness and pushability. Then there's Mamba Flex. This is also a small catheter, and it has one French crossing profile. So, it is even lower than this. And that's the good thing about it. It helps in going through very small vessels. So if you have very, very small vessels or very small size vessels, I would try considering, Mamba Flex in those cases. In cases of exchange, when you're just doing exchange catheters, Caravelle or Mini, not the catheters, just the wire, um, I try to use one of the other where just the the goal is not to cross, but just, put the wire in, get the catheter out. So I use these two catheters. Then our angulated catheters, there's I think Teleflex makes Supercross. There are multiple catheters. Each one is angulated. So there's a 45-degree. There's a straight tip, soft tip. There's a 45. There's a 90-degree. There's 120-degree. There's 90-degree extended tip. So if you really want one of them, I would say 90-degree extended tip would be the one to choose. Our lab carries 120 and 90 extended tip. There's also Swift Ninja. This one you can torque and turn in up to 180 degrees. So very good torqueability of this. And then you can lock it in the place. That's a good thing about this catheter. Venture catheter keeps on coming and going. The issue with this catheter is that it is much larger tip, and frequently when you need it, you cannot use it because the vessel is small in size and it cannot completely flex. You cannot lock this one. It is made by Teleflex. There's an 8 millimeter tip. Okay, so that's the issue. You really need an 8 millimeter, actually not 8, but like 5 to 6 millimeter size vessel to work on this. So it works in very large vessels, or if you're in the left main and you're trying to go into the circumflex artery, it may work in there. And it was discontinued. I think it's back again. You have to do rotational clockwise turn on this. So you have to memorize what turn direction and you should take. Collaterals, I use Caravelle. You can use Fine Cross. You can use Turnpike LP. Basically, you have to use a smaller profile catheter. If you need some penetration into the plaque or plaque modification, I would say, then you would use Turnpike Gold. There's also Turnpike Spiral. Turnpike Gold is very similar to the Spiral, and it just has gold-plated metallic tip, which gives more support than the Turnpike Spiral. So it's a Spiral. So if you want to keep one of them, I would keep the gold version of that. You cannot really use it in the vessels less than 1 millimeter in size because it can cause perforation, and you should not use it. So there's about 3 centimeter tip, which is the outer layer just behind the gold tip, which is also very pushable, and it is made up of stainless steel tip. In terms of, in terms of the Corsair Armet, I did not put it here. Corsair Armet is another one that we like. You can use as a newer catheter, Corsair Armet. It's a very torqueable device. Its tip entry is the smallest. It's 1.5 French out of all of these penetrating plaque modification. And has a lower entry profile of about 2.3 French. Okay, it has a durable tip. In patients who have fibrous or very calcified plaques, you can use it and then insert the wire through that. And then the older version of all of these plaque modifiers was Torna. So I used to use it, not use it anymore. It is full stainless steel coil shaft, great support, but it's very stiff. So sometimes in tortuous vessel, it's not easy to advance this, and but it gives a good support. So my method of using these is if just this small catheter does not cross, I use the smallest Mamba Flex or Caravel, then I switch from the small to penetrating and try that. And if that does not cross, then I just push it as far as possible and just put the atherectomy wire and then try to do atherectomy through it. And then there are dual lumen catheters. Suzuki is one that I like the most. However, there used to be twin pass, it still is, and twin pass torque, where you can actually torque the catheter to direct where you want to push the wire. There's also Enhancer RX Recross. Recross is the only one where you can put two wires without it's over the wire system. So the rest of the systems are rapid exchange. What is rapid exchange? I think I explained it in one of the balloon videos of mine, that there's a wire. So you have a wire in the vessel. This wire comes out here, just like usually from the balloons. And then this is one lumen, and the second lumen, which is distal, you can directly push the wire through this, and it comes off somewhere here near the tip at an angle. So all of these except twin pass have a gap about 6.5 millimeter from this distal tip, while the twin pass has this 20 millimeter. So that's why the Suzuki is great, because it's really close to the tip that you can come out and you're right there. But sometimes you want to do parallel wiring, so you can use the twin pass torque in that case. So can you please so I was saying that Suzuki is much more kink resistant and pushability is great. So if possible, you should get this one. And sometimes twin pass torque is helpful because you can torque. You can torque even Suzuki, because sometimes the wire is not in the direction of the entrance. So you may have to torque the catheter to get the direction towards the where you want to penetrate. So there are a few terminologies like microcatheter fatigue, turning too much, like more than 10 times in one direction, will cause microcatheter fatigue. It can actually trap the wire, and the wire may not come out. So you have to be careful. It can get kinked. It can cause tip fracture. The wire can get interlocked. This is something it's kind of, you need to kind of look at this video or memorize. Venture catheter, turnpike goal. Turnpikes are clockwise rotation while pushing forwards, and counterclock when pulling back. Okay. Corsair, Tornus are counterclockwise while pushing forward, and pulling back, they're clockwise. Okay. Pull. Nanto technique is an interesting technique. Basically, it is a hydropressure technique where the microcatheter, you put what I use, you can put a syringe and pull the microcatheter out after pushing the wire in as much as possible. Or what I do is I actually put the end deflator on the inflation device and go up to like 15 atmosphere or 16 atmosphere on it, and just ask the person who is keeping it to keep it constant, and just press down on the TUHI or whatever the device is you're using, the Copilot, and this will automatically push the catheter out. You just have to sometimes slowly pull out. With the supercross catheters, it will be difficult because there is some resistance. Larger guide catheters like 7 or 8 French, it's very easy to get it out. Okay. You can also do many things for like guide exchange, like you can put a balloon down and balloon trap it, or there's a dedicated catheter called trap liner where you can trap the wire and pull the microcatheter out. As I said about distal injections for no reflow is very interesting or nice thing to do with dual lumen microcatheter or single lumen microcatheter. And then coiling, I just want to go over the coil. So the Penumbra makes this ruby coil, and this goes through the Corsair catheter or Turnpike, even Turnpike LP, it takes it. Corsair Pro takes it. There are also packing coils, but if there's any perforation, I would use ruby coils. These are helical coils. They can, tap it up, whatever. And you want to use like 4 to 6 millimeter in size. So try one, inject. If there's no no flow, there's no extravasation, you're good. If there's extravasation, you can push more. In terms of using fat, you can make an incision in the groin and make it a deeper incision. Use your forceps to take out a lot of fat out of there, like just rip it out. I know it seems very bad. Dip it in the contrast because you won't be able to see it in the microcatheter, and then fill the tip of the back end of the microcatheter with some contrast. Inject it with so you can actually suck this into a syringe, this fat, and then inject it through that syringe into the microcatheter. Okay. Once it's injected into the microcatheter, then either with the back end of a guide wire or even in the front end, you would know where because you cannot really see it very well, but you can just see the distal end of the wire. You can push it into the location where it should be. Don't advance the back end of the wire outside the microcatheter, otherwise it will cause another perforation. Now, if you want to compare these, this is a very good website. So you can go to this website, Cardiovascular Interventions, and you can actually compare all these microcatheters. So for example, Asahi makes Tornus. So I want to compare Tornus with Mamba Flex catheters. And you can see all these wires and end holes and distal size. As you can see, Mamba Flex is like 1.4 distally. There are many more. So reflow, I've never used reflow, but most of the other ones are larger. But I want to compare these two, and I just press compare. And see this, it shows up like something like this. So construction stainless steel braided, this is coil. Okay. So stainless steel is much stiffer, okay, and can get D-shaped. Proximal size is 3.3, this is 2.9. Middle size 2.4, which is larger. And then distal size is 1.4, much smaller. Catheter length, of course, you know these lengths. Recommended guide wire. Catheter end hole is ID is 0.018. And there's radio opaque tip, hydrophilic coating is present in this Mamba Flex. So that's why it's easier to go through. This is a great website. You can go to the balloons. Okay, you can go to the sheets. So valvuloplasty balloons, you can go over these valvuloplasty balloons, etc., etc. I'm just giving an example. The multiple, this is a great website to look at. Oh, I think that's it. Thank you so much for listening to this. If you have other questions, this is dedicated to Dr. Kashif, who has asked me to make this video. Thank you so much.